Welcome to our interview today. My name is Marianne Kannengiese, and with me today is Professor Dr. Michael Frass from Austria. Welcome, Michael.
Hi, good to see you, Marianne. Thank you for invitation.
And we have a wonderful topic today. We are talking about the periodic fever syndrome of children, which is a quite new disease. And maybe, Michael, you could describe the disease and tell us a bit more about it.
The first description of this periodic syndrome, periodic fever syndrome, was in 1987. It was called Marshall's syndrome, and it includes children suffering from high fever of up to 40 degrees Celsius, and also of afts in the mouth, and pharyngitis, and also cervical adenopathia or cervical lymph nodes. So those children usually start with high fever for up to 5 days. Fever is constantly high, and after 5 days, children display regular temperature, and after 4 weeks, the same period starts again for 5 days fever, and for about 3.5 weeks normal temperature. Of course, this time course can be shorter. I have seen children within 2 weeks periodic fever, but I have also seen one child with 60 days periodic fever. So it may vary from child to child.
And the disease, of course, is very painful if we think of all the ulcers in the mouth.
Yes, I think this is the main problem. Most of the children have no problem with high fever, but as you just described, after changes in the mouth and also pharyngitis are the main problems causing pain in these children, and also, of course, problems with food intake and drinking, as everyone knows who has ever had some problems with mucous membrane in the mouth, or especially of the tongue. So it makes everyone very nervous, of course, especially the parents.
Yes, and from conventional therapy, we don't have very much to offer, I think.
In the beginning, as far as I could find out, antipyretics were used and also antibiotics, but both of them did not really work. So despite antibiotics and despite antipyretics, the fever remained high for at least 3, 4, 5 days. And later on, this therapeutic approach was cancelled, and it was replaced by giving cortisone. And it is also now suggested, or at least some people consider it, to use colchicine as a modulator of the immune response.
Colchicine as a poison is quite dangerous, as far as I can remember. How can we use this with little children?
You know, I would say if there's a life-threatening event, I have no problems to use it, but most of the children have no real difficulties with this high fever. And of course, in addition, antipyretics should not be used as prescribed by conventional pediatric doctors. If you listen to scientific pediatric doctors, you will find pediatricians, you will find that they also recommend to neglect antibiotics. And also antibiotics, you know, I think antibiotics work very well if there are some special bacteria present. You know, I have worked for 20 years in the intensive care unit treating critically ill patients, and it was up to 1997 that sepsis, septicemia, was associated with the presence of bacteria or viruses or fungi. And only in 1997, a striking paper was published saying that only in about 30% of critically ill patients suffering from septicemia, bacteria, viruses, and fungi might be found. And, you know, I was there for 20 years, always confronted with very dangerous agents. I never suffered from a very severe disease or septicemia, which means I think it's primarily the immune system or the immune response which is responsible for a good health, and bacteria only will invade you when your immune system is disturbed. So I think one of the main questions which are not solved up to today is one of the main questions is that we believe or we think that it is not the bacteria at first causing septicemia or fever. I think it's primarily the reduced immune status, and then the virus or the bacteria invade your body. So I think this may be explained by a famous Austrian who lived during the time of plague. His name was Augustine. They say it's something like funny Augustine. I don't actually know whether or not funny is the right word, but he was a very nice guy, and he played Dudelsack. I just think about the English word for Dudelsack. I can't tell. It's just an instrument with a bag and a lot of flauts. And he was very, very fond of drinking alcohol. So one day he fell into a grave where a lot of dead corpses, people who have died from the plague, were lying. And the next day, people heard him singing, and they pulled him out of this grave, and he survived. So I think if you're in a very good condition, you may be surrounded by billions of bacteria, viruses. You may survive, and as everyone knows, only 30 to 40% of the European population have died during the plague, but not 100%. Still, of course, 30% is a lot. This just let's give you a hint that the immune system is a little bit more complicated than it is suggested.
Yeah, the immune system is another thing. And of course, Louis Pasteur as well said it's not about the bacteria or the microbe, it's about the milieu.
Mm-hmm.
And
I believe, as you just said, you may be surrounded by a lot of bacteria, as all the people working in the intensive care unit are. If you are healthy and in a good neuroimmunological and psycho-immunological state, then you will survive, and you will not get ill. And as I think every one of us knows, if someone tells you every day you're a bad person, your work is nothing, and we would like to kick you out of our company, then you might become ill much easier than if your boss tells you your work is good. We are proud to have you in our company, and we think you're a very valuable person. So I think there's always a combination between psychological status and immunological status.
Definitely. So when we say we have problems with children nowadays from the 1990s on, which we didn't have before, we have to think about that because children react to the mothers, they react to the environment, and of course they react to the problems in their surroundings and to the toxicity.
Yes, I think it's actually we don't know the reason for periodic fever. Of course, you might find some genetic mutations, and I don't know exactly the number of different types of periodic fever syndromes. The most famous is the PFAPA, which is more or less diagnosed by exclusion. And but you know, in homeopathy, we are not so much keen to know the exact diagnosis. We are much more interested to look at the symptoms and to treat a patient with a homeopathic medicinal product covering most of these symptoms. So the name of the disease is not so important. And I think it's like the name of the rose, the book from Umberto Eco. And at the end it says, the rose from the past just stands by its name, and we just have the names. So names are something which might help you and give you the right direction, but you are not depending on genetic analysis and so on, which actually is not even done in Austria, and in most of these cases. So I believe it's a syndrome which offers a lot of activities for homeopathic treatment.
So when we're thinking of homeopathic treatment of the periodic fever syndrome, did you find very individual symptoms or more common symptoms in the children?
I think the main, the most important symptom is the sudden rise of temperature, and the high fever and the sudden end of fever. So, of course, everyone thinks of atropa belladonna at first, and I'm also sure, and in my experience, belladonna is the most important homeopathic medicinal product. But then it may be different. I have treated a child, and this child obviously was somewhat jealous on the father. So sometimes after 2-3 sessions, I decided to give lachesis, which is my most beloved homeopathic medicinal product, as you might know. This child now has no fever for, I don't know, 3 months or whatever, or even more. And another child, it appears that he felt offended in the kindergarten because there was another child, a female, and she refused to play with him. So he was offended, or he was a little bit angry or suffering, not angry, but more suffering. So I think sodium chloride or natrium muriaticum seems to help it, but this is the only unsolved case so far. So I'm still working on it, on this case.
So I see there are not only acute remedies involved, there are remedies like lachesis involved, which might be constitutional remedies.
I think, of course, you have to look to the constitution as soon as the acute situation is banned. And in some cases, it might be calcium carbonicum. But then you have just to use individualized homeopathy, and I think there are no real. I wouldn't give any hint or say that you have to use this or that. I believe this makes homeopathy such a precious method because it is always you're always looking to a different child or a different person, may it be a child or may it be an adult, and there's almost never routine. And actually, this is what I like very much.
Yeah, I can imagine. This is what it makes a bit of a Sherlock Holmes work.
Yes, but the problem is, opposite to my sister, I'm very, I'm not lucky finding out with a criminal story who was the killer or who was the thief. So I'm just, I think I'm just somewhat successful with patients. But this makes me happy because, you know, one day, actually, two parents, without asking them, told me that the behavior of the children has improved very much. And this is what I think is the main aim of homeopathy. Not to, it's nice if you have no periodic fevers, this is clear, but it's much better if the parents, actually there are three parents now, three, who have told this without asking them. And this is what I feel, and I become really lucky because then I feel that now we have broadened or widened the character of the child. And one day, actually, there was a couple, and the father, he was very, let's say, critical about homeopathy. The mother, no, but the father is. And at the end of the analysis of his daughter, he asked me whether there's anything in homeopathy which could help to treat his falling hair. He had some spots. Yeah. And I said, okay, well, we just could try it without analysis because there was no more time. Next time, when the family came again, he said, oh, my hair was growing again, so he's now very much in favor of homeopathy. And the child was also happy, also healthy. So I think, you know, I believe homeopathy as well as the whole field of medicine is more, it's better situated in females than in males because I don't know whether this is the right, correct English word, but common sense is something females are born with, while males have to think and to work and to become philosophers, and finally they say, oh, I'm a rationally thinking man and now I can try. While the females have already treated the children and the children have a lot of benefit of it. So I think when a child becomes healthy, this is also very important because the first family, the child was suffering from periodic fever with 4 weeks periods. And after half a year, the boy was about 1 year at this time, these periods were reduced to 2 weeks. So 5 days fever, 9 days no fever, 5 days fever, 9 days no fever. And this family had no backup from grandparents. So they were already very much annoyed. And when you feel that this child becomes healthy, it's a very good situation, and it makes you really happy, and you feel that the whole family has an advantage because they never could plan anything because it was not clear whether or not the boy might suffer from fever.
It's quite clear that the advantage of homeopathy goes much further. But I have a question. You said the behavior of the children was, in some cases, the behavior got better. Were the children violent or on the angry side or sad side? What
I
was
would
the
say,
mood of them?
I would say some of them are angry, but I would say more of them are more introverted.
Introvert.
So they're a little bit more passive and not so much keen to play with other children or with siblings. And also, let's say, not so self-conscious. And
Oh, I
I
see.
think this is, usually a child comes here and say, I'm here. Yes.
Mhm.
And some of the children, if you're not healthy, if something is not working very well in your body, then your self-consciousness may be reduced.
This is just an intuition I have as a vet. But may this initially mood swing in the children have to do something with vaccination? So
Sorry, I
that
don't understand.
but I just wondered whether the mood swing of the children might have to do something with bad results after vaccination. And then slowly by slowly, the periodic fever came.
This is difficult. It's difficult to find out because um, most of the children start with this periodic fever a while after the last vaccination.
Yeah.
So I cannot prove it, but it could be. Vaccination might have adverse effects, but usually they are not so well accepted because there's no way to measure the negative effect of vaccination. You can just propose it, but you cannot really define it, or you have no parameter.
Mhm.
So it might be, it might be not, but
Hard to prove, I know.
yeah.
But I just wondered because we have the same thing in cats.
Yeah. They have also periodic fever.
They can get this after situation in the mouth where you don't know where it comes from. And you can't really detect something. And of course, they have fever with it, and they have change of character with it, and it's very hard to treat. Some of the cats end up with no teeth, a lot of cortisone. And one of the best therapies is implantation of gold.
Implantation of?
Of gold in acupuncture points.
Oh.
This is what the best therapy at the moment is. And I just wondered whether we did kick off all those things by over vaccination.
Did you also try belladonna on those cats?
Oh, this is, I'm out of my homeopathic clinic already, but in former times, of course, I did.
I think whatever might disturb your immune system should be kept in mind. And we should only be cautious if vaccinations are produced which might disturb your genetic pattern. And I think there are some very famous people like Professor Suharit Bhakti who are accepted virologists and specialists, so far away from any controversy with conventional medicine, which warn to use genetically
modified materials.
Yes. And sometimes there's also just a very nice meeting in Venice. I'm treating a boy from Switzerland, and we just did it telephone. And, so the boy is doing better, and just by chance, his family was also in close to Venice, And just by chance, we decided to go to Venice the same day. In the morning, the father told me, and I understood, the boy has now otitis media. So I said, okay, you might use this and that, but he didn't have it with him. And finally, we really met in Venice for the first time. And it was found out that it was not the boy, but it was his sister suffering from otitis media. So I gave her some pulsatilla, and obviously she did better the next day. So I think in this moment when you start with homeopathy and when the parents see that there are improvements possible, then they understand that you might treat first the other child, and then usually the mother comes, and after 2 or 3 years, the mother brings or calls her husband or to the doctor, and he sits down here and he says, I'm just here because of my wife. I'm a rationally thinking man, and I don't believe in homeopathy. I say, oh, that's exactly the same with me. I'm just here because of my wife. I'm a rationally thinking man, and I don't believe in homeopathy because it works. I don't have to believe. Belief just means I have troubles whether or not it works. Homeopathy is not religion, it's just a medical method. And this makes it different. But exactly, especially with the Swiss family, it's the father who is talking to me all the time.
As I understand, and this is the same. People tell me all over the planet, whether it is in India or in Australia or in America, it's the children that come first because the mothers take them. Sometimes the mothers are treated during the birth already. So they take the children get the therapy, the mothers get the therapy, usually the aunties get the therapy, and sooner or later the husbands come. So a homeopath sooner or later ends up with the whole family and then has the overview over the system and the problems that goes on the mental and psychological level.
Yeah, I think you have described it perfectly. And I just think, of course, several male patients who come by themselves, but I have also the feeling, but this is not proven, that in most cases females react better and to homeopathic medicines, and this is something which is independent from the homeopath, whether he's female or male, whether she's female or he's male. And I think I think 2, 3 females displaying idiosyncrasy, and I can't tell you one male with the same reaction. So I believe it's more, but also conventional medicine is much more in the hands of females, because I estimate that about 50% of females prophylactically go to the gynecologist, but I believe, I have no numbers, maybe 10% of males go to the urologist just prophylactically. So I think this connection to medicine is much closer with females.
Yeah, this was always the traditional thing, because mothers in other centuries had to care for the children. They had to know about herbs and natural medicines and natural procedures that you can take when somebody is ill. It was in the hands of women all the time, all the centuries. It's just now that we have it in the hands of science. 200 years back, it was a bit different, or 300 years back. We are very happy that we had Hahnemann, who developed homeopathy about, how long is it ago? 220 years ago? And still, we have a lot of homeopaths here in Europe who work with it. But as you told me, in Austria, we actually have maybe 800 homeopaths who might work with homeopathy. We have a lot more in India, where homeopathy went to another level, where we can study it and it is taught in colleges, and we have a lot of doctors who offer in rural camps cost-free treatments for the population who can't afford.
I think India is the land of hope regarding homeopathy. And also it's an open country. It's not so much focused on just one method, or you know, they have still this ministry, which is an independent ministry for Ayurveda, Yoga, Siddha and homeopathy, and I think it's very far. The only country in Europe I'm aware of, which is also very far advanced, is Switzerland, where the people have voted for including 4 complementary methods into the legal status. I don't know the correct word for Verfassung at the moment. And I think Swiss people cannot be assumed to be silly or not to know how to work with money.
Yes, Swiss people traditionally they're very conservative, but in this case, they voted for homeopathy, and we are very glad to have a very good homeopathic school in Switzerland, which is led by Dr. Martin Hughes. And yes, I guess if we ever will have an homeopathic hospital in Europe, it will be in Switzerland, won't it?
Yeah.
How do you see the chances of us getting an homeopathic hospital here in Europe, which is quite usual in India?
I think I think the main problem seems to be that homeopathy is more a method which could be used in an outpatient department, outpatient unit. Since most of the chronic cases need some time of observation, I think it's not probable that people are staying in a hospital for a few weeks just to observe whether or not rheumatism becomes better, because usually it takes some time. If you are suffering from a very acute disease, in most cases you need a basic conventional medical treatment, and then you might also use homeopathy. And if you look to the first hospital which I'm aware of in Köthen by Dr. Lutze, it only worked, I think, for 20 years or so, and then it did not really continue. I think I would suggest that the best would be to have homeopaths available in any hospital who might be called to patients, similarly to what is done by Dr. Sigrid Kruse in Munich. And she has unbelievable success. You know, she also would have liked to do a study with children from drug addicted parents and newborn children, newborns, because they react very well to opium in a high potency, in a homeopathic preparation, but using a very strange explanations the ethical committee did not allow, despite the fact that homeopathy could be applied immediately, while the administration of morphine, and these children takes much more time.
Yeah.
And, but you know, they were afraid, maybe of competition or whatever. So I think to run a hospital also means you have a lot of administration. So if you don't have someone who takes over the administration and the fundraising, it will be very difficult. And the status in the moment is not in favor of homeopathy in Europe. It may change at the beginning of next year because I think people slowly but steadily understand that they would do much better with homeopathy. So in case you would start with a hospital, I would recommend to start the hospital offering several complementary methods, including homeopathy, but not only. I think this is homeopathy is on the top of the criticism, and it is very difficult to perform this method under hospital conditions.
Mm-hmm. Yes, of course, here would be much more criticism, especially if something would went a bad way, would go a bad way.
Mm-hmm.
So back to the periodic fever in fever syndrome. In the children you treated, is there a specific pattern that developed after the therapy, besides that the behavior in some got better, and of course, the disease itself?
I think what I could observe, I would say in about 50% of the children, you know, there are only 7 or 8 children so far.
Mm-hmm.
In about 50%, there was an immediate reaction,
Mm-hmm.
and periodic fever disappeared, and we only continued with constitutional remedies, but without symptoms. It was a symptom-free time. And the other children obviously seem to have some underlying cause or reason why this disease became obvious. And so you need from the beginning not only an acute remedy like belladonna, but also some constitutional remedy or remedy which is just indicated at this time. And what I do when the fever starts, I'm called every day by the parents, and we decide every day what could be done. So I think it makes sense to have a close connection, especially because parents with no experience with homeopathy so far, they would be despaired if they don't have the possibility to call me anytime.
Yeah.
Every day.
Yeah, they would get anxious sooner or later.
Usually I don't offer calls during the night, but during the day is no problem.
Yeah. What about the potency? Do you take special potencies? Do you dilute them in water and take sips, or do you give the globules? Is there a specific pattern in it?
I would say with belladonna, usually I prefer C200, CH200. And also with constitutional remedies, usually I try high potencies. Because I believe children have such a high energy level, they can easily handle high potencies. I would not recommend this in all elder patients because this might cause heavy reactions. But in children you can do, but I also use LM potencies in some cases. And because I think it's a little bit softer, and you may also, it it's easier to change from one remedy to the other if it is necessary. And belladonna, I think, is, it's an acute remedy or a remedy for acute situations, and therefore hypotency is allowed. And I also give it several times a day sometimes. Opposite to the chronic situation, of course.
Yes, of course.
But in acute situations, as we have also described in several case reports in the intensive care unit, I think people in these situations need heavy treatment so the body can react.
Okay. Do you dilute the globules in water and give many doses, or do you give the globules many times?
Usually, I give the globules several times,
okay.
But in one child, during the fever with calcium carbonicum, the lymph nodes exploded, so it might have been better to use the dilution in water and to give it and just observe. I think in most cases children are strong enough.
Yeah, I think so.
Yeah.
Just a bit like cats. They can take a lot.
Yeah.
Any other specific thing that came up during the periodic fever treatment?
I could imagine, for example, that natrium muriaticum as a chronic belladonna could always be suggested. And in addition, as you just suggested, Tuya might be a very good indicated homeopathic medicinal product because of negative effects of vaccinations. And I think I also like to use, in some cases, pulsatilla. Of course, acetomasenicosum, which might also help. I think there was one case where the arsen was a very good help. But otherwise, I think you just have to rely what the parents tell you and what the child is exhibiting on symptoms. So I think this is the reason why during a fever period, I call, or the parents call me at least once a day. So we can adjust the medication to the actual situation.
So if we are any parents listening who have a child that suffers from the periodic fever syndrome, they can contact you, and slowly by slowly you're going to be an absolute expert on it.
I think, children are very, very good because they have a very good immune system, and there's an ongoing study in India with newborn, and they're comparing newborns with randomized conventional medicine or homeopathy, and it appears that the number of conventional drugs could be reduced significantly. And of course, some people are not happy about it, but I'm just happy if a child is doing well. And I think they have an incredible power because, the grandson of my wife, he's running the whole day. He's talking the whole day. He's a boy, but he talks constantly. It's unbelievable. And he has unbelievable energies. And I think there was also an investigation many years ago in Israel, and soldiers should imitate the movements of children. And after a few hours, the soldiers were completely down because you cannot compete with a child. Its activities, jumping, rolling on floor, and so on all the day. And this at this time, I think those people or those children, sorry, are much more prone to react positively to homeopathy.
Yeah, yeah, I absolutely agree. So, is there anything that you want to say at the conclusion of this interview?
I would say, first of all, thank you again for talking about this subject, which I think is so important because I believe in at least 70, 80, 90%, it is possible to get children rid of cortisone, which actually does not really work very well. All the patients, all the parents who have told me about cortisone, they say, okay, it helps just shortly, but it doesn't work for a long time. And I think cortisone is a very valuable, very important drug, but it should be kept for life-threatening situations or for chronic diseases which cannot be treated in another way. But if it is possible to heal a child, it's such a wonderful experience, and you feel fine as a doctor, and the parents feel fine, and the child too.
Yes, he comes again, but maybe because I should say that in cats it's absolutely the same. The cortisone helps only a short time. It does not heal. And yes, we have a chance with homeopathy and we have a chance with other treatments, but we don't have a chance with conventional medicine.
Yes.
So thank you very much for the interview. Thank you very much for your knowledge. And yes, I'm looking forward to our next talk.
Thank you. Many greetings and have a nice day.
You too.
Bye-bye.
Bye.